Public health officials pay a great deal of attention to statistics regarding prevalence of disease in various populations. These studies are helpful in determining which communities are most vulnerable to developing certain diseases. To be vulnerable to a disease means that an individual or group has a higher risk of developing or contracting that disease. Public health officials like to discern which groups are vulnerable so they can pay special attention to helping them avoid the diseases to which they are most susceptible. Another term for vulnerable is at risk. By studying disease prevalence and statistics, health officials learn which communities are at risk for various diseases. For example, the population most at risk for Tay-Sachs disease, a genetic disorder, is Ashkenazi Jews or those of Eastern European descent. The prevalence of new HIV infections is highest amongst Black males between the ages of 13 and 24, so this population is considered most at risk for HIV. Native Americans are considered an at-risk population for type 2 diabetes because diagnosis rates are highest in this community. As you can see, the at-risk populations can be very different depending on the disease or condition being examined. Generally speaking, however, those groups often considered at risk for diseases include children, the elderly, minorities, immigrants, the homeless, war veterans, the mentally ill or disabled, and those living in poverty. Oftentimes, these categories overlap, and the risk of disease can be compounded. Migrant workers represent a special group that is often considered an at-risk population. These workers travel around the United States and even outside the country to find work. Oftentimes, migrant workers are minorities and immigrants, and sometimes they live in poverty as well. They may not easily find health care or even housing. Many migrant workers are employed in agriculture and travel the country working to harvest different crops. As a result of their jobs, migrant workers face specific risks to their health. Health risks that are associated with a certain job are known as occupational hazards. The occupational hazards in agriculture include vehicle accidents, heat exposure, falls, muscle and skeletal injuries from repetitive activities and heavy lifting, dangerous machinery, unsanitary conditions, exposure to pesticides and other chemicals, respiratory illnesses from contaminated air, and others. Agricultural work also comes with its own set of environmental health problems. Environmental health hazards include poor sanitation, air or water pollution, UV radiation, and infectious disease outbreaks. Chronic health issues include those diseases and ailments that last a long time, usually for years. Chronic diseases may be the result of lifestyle choices, genetic predisposition, or even certain occupational hazards. As with occupational and environmental health hazards, there tend to be certain chronic health issues that affect migrant workers in particular, such as high blood pressure, mental issues like stress, anxiety, and depression, and diabetes. Research is needed to understand the specific health needs of migrant workers. The National Center for Farm Worker Health helps to do that research. The Office of Minority Health is another organization that focuses on minorities in particular. According to the Office of Minority Health, all minority populations are vulnerable or at risk for the following health problems: infant mortality, diabetes, cancer management, HIV infection, cardiovascular disease, and lack of proper immunization. Because minorities have been identified as being at risk for these health issues, healthcare providers and public health workers can pay special attention to these conditions when dealing with minority patients. Hopefully, by making a bigger effort to address and prevent these problems within minority groups, we can start to see a decrease in health disparities across the country. While the Center for Farm Worker Health and the Office of Minority Health focus on very specific groups for health advocacy, other organizations work on a broader, more general scale. The Centers for Disease Control and Prevention, or CDC, is the National Public Health Institute of the United States. Its goal is to safeguard the health of all individuals living in the United States by preventing disease, injury, and disability. The Environmental Protection Agency is a U.S. government agency that aims to protect human health by safeguarding the natural environment. Working on an even broader scope is the World Health Organization, or WHO, which is the United Nations agency for worldwide health issues. The WHO's objective is the attainment of the highest possible level of health by all people on Earth. This organization defines health as a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. This is a lofty goal that in reality is very difficult to achieve. Throughout the world, there are a number of factors that challenge community health and affect access to health care. The mission of the WHO, and all public health organizations for that matter, is complicated by poverty, rapid population growth, availability of health services, and dangerous environmental conditions like pollution and war. These challenges require global collaboration to overcome. By working with our own local communities and striving to contribute to the global community, we can help to reach for the World Health Organization's vision of complete well-being for all.